Hello class and welcome back. We are starting chapter 8 where we will be talking about abortion. When it comes to the legalization of abortion, it's important to really get the facts and the truth that happens behind the different court cases that really pushed through the narrative to legalize abortion. The first anti-abortion campaign happened in the mid-19th century, and it was really pushed through by physicians because women were performing self-induced abortions, and physicians felt that they were the only ones that were qualified to actually do that in a safe manner. So it really started as a way for women to have a safe way of doing it. It wasn't until later where the morality of it all came in, and that's where now we have the two sides, pro-life versus pro-choice. Thousands of women did suffer injury, but again, that's because they were performing self-induced, or they were going to individuals who are not healthcare practitioners who are trained at performing this type of surgical procedure. In 1973, it's important to understand Roe versus Wade, and a lot of individuals understand Roe versus Wade as some anonymous woman that was gang raped in Georgia, and she got pregnant and she needed to have an abortion for financial and personal reasons. Later, the story came out by a woman named Norma McCorvey, who is actually Roe, or Jane Roe as they called her, and it turns out that that was a lie, that she was never gang raped. She just had sex, got pregnant, and she financially couldn't support the child. So really our entire legalization of abortion was founded on a false story and a false narrative of a woman who never was raped, who was never in that 1% of cases of individuals who may need to utilize abortion as an option. It was a part of the 99% of the individuals who just have sex and don't want to take care of the responsibility, or feel that they can't take care of the responsibility, right? Current model separates abortion from other reproductive care services. Abortion very much is a different type of service. If we really want to get into what it is, you'll find that out in the later slides. There are continued attempts to restrict abortion, and those continue, but there are also attempts to broaden the time frame of abortion as well, and we'll talk about that in the next slide. All right, it's important to understand abortion. So abortion generally refers to a pregnancy ending, but we have to understand there's two different types. There's spontaneous abortion, called a miscarriage. This is something that naturally occurs for whatever reason the woman's body is not able to carry the baby to full term. Sometimes the placenta starts to detach from the uterine wall. Sometimes there's high inflammation in the woman's body that cannot support the child. There's a lack of blood flow to the child. There's a lot of different reasons as to why an abortion may occur. There's also induced abortion, and this is called is the normal abortion that we know, which is intentionally ending the pregnancy. And again, there's different stages that a pregnancy can end, and there's different types of surgical procedures that happen in order to end that pregnancy, and we'll talk about that later. The term viable is used to indicate the point at which a fetus would be able to survive outside of the womb. So let's say a woman went into early labor. There's a certain amount of time, generally about 6 months, of the baby being grown in the body, where the baby could survive via different medical interventions outside of the body if early delivery were to happen. In the United States, there's some abortion stats. Unintended pregnancies include those that are mistimed and those that are unwanted. So there's about 60% of abortions happen because of individuals who just didn't want to have a baby at that point. More than half the women with unintended pregnancies continue their pregnancies and give birth. All right, about 1 million abortions are performed in the United States each year. The number of abortions did rise with Roe versus Wade until the 1980s, and that's when abortion steadily started to decline. We're currently at a stage or a level where abortions are continuing to decline because individuals are changing their perception and their mindset on what abortion is, and the true facts about what abortion is coming out. Right? So here's a timeline of rate per 1,000 women, abortion rates versus birth rates versus pregnancy rates. And as you can see, most of the lines are going to be semi-steady. With the feminine movement and the women's movement, there has been a decline in just pregnancy rates overall, especially when it comes to later age in life. A lot of women are waiting to a later age to make sure that they are emotionally stable, they're financially stable, and they have a partner that is going to be able to help them raise that child in a healthy home environment and produce a great individual who can contribute to society. All right. Here's the distribution of abortions by age, and as you can see, the majority of abortions happen with women 25 to 34. This data is from 2014, so keep in mind that we are in 2020, and that our author just did not update this data yet. But that data is starting to again shift, where there's a decrease of overall abortions, but the age frames are still generally the same. For me, it's important to show the development of the fetus because, again, we want to be scientific based and we want to show where that fetus is at. So this is an embryo at 9 weeks on your left and at 10 weeks on your right. And as you can see, there is full development. The first things that develop is going to be the neurological system, is going to be the circulatory system, and then we can start to see the limbs and things develop later. Keep in mind that abortions in most states in the United States are legal at this point of the child development. When it comes to abortion indicators, there's different reasons as to why individuals will state that they chose to have an abortion. Lack of financial resources are at the top of the list. That's why most women state that they got an abortion, because they financially could not support the child. Interference with a woman's work, educational aspirations. So a woman wants to continue her education. She wants to go into med school, or she wants to go into law school, or she wants to go into an educational program that's going to take years, and it's going to take a lot of attention and time, but as does a baby. And so she may choose to opt for an abortion at that point. Ability to care for dependents. You have a woman that has multiple other children, and again, she may not have the time, she may not have the financial resources to be able to take care of the child. Reluctance to become a single mother if the father of the child has left the scene. Problems in a relationship. Remember, a baby does not fix a relationship, so please do not try to utilize a child to stay with the person you're with. Fetal and maternal reasons. Fetus with life-threatening or developmental abnormalities. So there are situations where a woman may opt for an abortion, such as what's called an ectopic pregnancy. And with an ectopic pregnancy, I'm sorry about that. It's a little late at night. This is going to be where the egg is fertilized in the fallopian tube. And if you understand the female reproductive system, the fallopian tube cannot house a child. It cannot stretch. It does not have the ability to grow a child. And so if the egg or embryo does embed itself in the fallopian tube, then both the baby and the mother may die if that embryo is not removed. All right. So again, health risk to women, and keep in mind that when it comes to health risk of women and rape cases and incest cases, that's less than 3% of all the abortion cases that happen. There are also personal considerations that the woman must consider when she's thinking about options for herself. And where it says for the woman, there's 4 bullet points, and oftentimes for the pro-choice individuals, these are the different types of points that they will utilize to justify the choice of an abortion. So how the woman's life will change. Your life will change once you get pregnant and once you decide to bring a child into the world. Whether you're ready to take on a child or another child, how the woman feels about abortion or adoption, and financial consideration. So keep in mind that abortion is just one option. There's also adoption. There's also keeping the child. And there are a lot of families that cannot have children. So a lot of individuals are choosing the adoption route simply because of their moral feelings on abortion. But in terms of a child being born, we cannot forget about the man, because you cannot make a child with just a woman. You have to have the man as well. You have to have the sperm. And this is where some pro-choice individuals may disagree, which is okay. But the man can also feel emotions, and they can get physical symptoms as well. So like the woman gets pregnancy symptoms, a man can also get pregnancy symptoms. And so that whole process is very much connected between the man and the woman. And I think society is starting to view that and see that, experience that a little more. And that's why the ideas on abortion are changing, because now the man is being much more involved. Even though understandably the woman is carrying the child, there's only one way to make a child, and that's with an egg from a woman and a sperm from a man. All right, in some instances, some may disagree with the woman's decision in terms of choosing abortion, and they may try to control the outcome of that. So again, it's important to understand that when you're in a sexual relationship and you are intimate with somebody, that you need to have open communication in terms of what both of your life paths are. And honestly, if you don't want a baby, there's one way that you 100% will not have a child, and that is abstinence. But again, you need to talk to your partner about if that's a choice for you or not. Right? There's reasons that women have abortions, and literally it's just what we talked about, but put into slide form. So if you feel the need to pause this so you can look at some of the percentages, feel free. There's different types of methods of abortion. There's a medical abortion where there's 2 types of medication that are utilized, and it ends about 95 to 97% of the pregnancies. And this medical abortion can be pretty, for lack of a better term, tough on the woman's body, because essentially what it is they dose her up with these medications that are very toxic to the child, and the child starts to die and the woman starts to have a miscarriage. And there are reports of women that have chosen a medical abortion option. What the clinic does is they put them in a room and they put them in a hotel. They give them the medication. They say, all right, just go ahead and sit. You may feel some pain. You may feel some different types of symptoms. But when you start to feel the need to go to the restroom, just go ahead and go, push, close the toilet lid, don't flush, and then call us, all right? And essentially when the woman goes to the bathroom, she's essentially delivering the child in the bathroom. And for a lot of women, this is done by themselves. So there's a lot of mental effects that come from this. There's a lot of emotional effects that come from this. And obviously there's a lot of physical effects, because essentially you're inducing a miscarriage in the woman. And in terms of utilizing any type of abortion, initially the woman may feel accepting of the choice that she made, but every woman that I've talked to who has had an abortion, who chose that route, has regretted it, and they think about it every single day. So I understand that there are some individuals that kind of create a kind of rainbow type of idea about abortion, but when you medically look at it, it is very, very hard on obviously the child, because you're killing the child, but it's also very hard on the woman physically, mentally, and emotionally, and can be very hard on the man as well. All right, there's also an aspiration abortion, which is known as a suction abortion. I don't recommend looking up videos on this one because this is pretty gruesome if you really look at it. It's successful about 98% of the time. Unfortunately, in both of these types of methods of abortion, the child may come out still alive. And in that case, the physician may choose to create an incision in the base of the brain, or they may just let the child lay out and cry until the child dies. So again, this is when you really look at the science of it and you really talk to individuals who have been involved in the clinics of abortion, it's a very, very gruesome and very, very sad place to actually work and be involved in. All right, and when it comes to the suction abortion, oftentimes the baby is going to come out in pieces. So you may have a leg that comes out, you may have a torso that comes out, and so again, it's very, very tough, for lack of a better term, choice to make when it comes to a woman's body. All right, so here's an example of a suction abortion. So essentially what they do, depending on the stage of the pregnancy, and again, most states will require an abortion to happen no later than 3 months, although some states are pushing for late-term abortion, meaning that you can kill the child up into after the baby's actually born. And let's just be frank about this, it's murder. Whether you agree with it or not, if you kill a human, it's murder. So it's important to understand these true facts, and it's important to not get bogged down by the different types of glorified ideas about abortion, and it is very tough. So as you can see in the suction, with the suction instrument, they insert into the woman's vaginal canal into the uterus, and essentially they utilize a camera to see where the embryo is at or see where the baby is at, and they go ahead and utilize the tool to suck out the baby. All right, medical versus abortion or aspiration abortion in the first trimester. Medical abortion, it's more controlled, there's more privacy of the woman. It feels a little more natural because it, again, does mimic a miscarriage. It is non-invasive because what they're doing is they're injecting 2 types of medications, which is essentially going to initiate the miscarriage. The disadvantages, it does take a while. So again, that's why the clinic does give a woman a room to sit in. They give her a TV, food, etc. There's going to be a lot of side effects, nausea, vomiting, diarrhea. Again, essentially the woman is poisoning herself in order for the baby to detach and miscarry. There's more prolonged vaginal bleeding. So whether you have an abortion, whether you have the baby naturally, there's going to be vaginal bleeding because there's going to be tissue damage. And again, that baby is attached to the uterus. And so once that baby gets pulled off the uterus, again, either during natural birth or an abortion, there's going to be damage to that tissue. So you are going to have vaginal bleeding. All right, there's small risk of failure because, again, you're utilizing medication that's a little more controlled. The financial cost, though, is about the same. So if a woman were to choose this, it's really just up to the woman on what route she wants to take and what types of side effects she wants to feel. All right. Second trimester abortion, about 10% of abortions take place more than 3 months of pregnancy. And I do have some photos for you to see what a baby looks like at this stage. The woman can choose that for a variety of reasons. Again, you can go back to the slides where we talked about the financial issues, not being able to care for the child, et cetera, et cetera. Induction abortion, this is induced labor and delivery with medications. So again, this is similar to the medical abortion or medication abortion, but it's just going to be done at a later stage. There's what's called the D&E. It's a dilation and evacuation. It's the most common type of second trimester pregnancy termination that's done in the United States. So what happens is the cervix is dilated. The vaginal evacuation is utilized by a suction instrument. And again, like I mentioned earlier, this suction instrument can oftentimes pull out pieces of the child versus the child altogether. So again, very, very traumatic type of experience to choose to go through. It's important to make sure that we have facts to support the different types of topics that we're talking about. And in this situation, I felt it important to show you what a 14-week-old child looks like. So this child is about 3.5 months if you have 4 weeks in a month. This couple did not abort the child, but they did unfortunately have a miscarriage. And it's important to see photos like this because we can see the true development of the child even at 3.5 months. And keep in mind that most states have accepted abortions up to this stage. All right, there is post-abortion care. Complications are reduced with good patient's health. Oftentimes the woman, if she chooses an abortion, regardless of what type of method, will go through a psychological screening with the physician to make sure that she is emotionally and mentally capable of making this type of decision. The dangers of this include fevers above 100 degrees Fahrenheit. And remember, when you have increased body heat, that you can throw yourself into seizures, you can throw yourself into further damage in terms of your core temperature getting so high, and it could cause death. There's definitely going to be abdominal pain, swelling, there could be backaches, there could be abdominal pressure and tenderness. Again, remember what is being done. The baby is being pulled out of the uterus, so it is very traumatic. There could be prolonged heavy bleeding, there could be a foul smell or vaginal discharge, so keep that in mind, and vomiting and possible fainting. So again, these are the reasons, because of these side effects, as to why a lot of women's lives were in danger by doing self-induced abortions. Because keep in mind that if you do something like this on yourself and you fall unconscious, you can't take care of yourself, and if there's nobody in the room, there's no one to help you medically in that situation. All right, other types of other aspects to post-abortion care. Possible emotional side effects. This is very, very important because, again, this is a very traumatic event. As the woman is pregnant, she does develop a connection. The majority of women develop a connection with their child, as do the fathers develop with their child. So this is why miscarriages are extremely hard on couples, is because they develop a connection with that baby. And for that baby to die, that can be very, very hard emotionally. Some women may have a mixture of feelings, which is normal. Any traumatic event, it's normal to have a mixture of feelings. We see this with our rape victims as well. To have a mixture of emotions is extremely, extremely normal, and they can range from day to day, right, depending on how the woman is progressing or how the person's progressing through this emotional trauma. In a study of those who denied abortions, most adjusted to motherhood. So this is important to understand, that individuals who do have a baby, who do get pregnant, maybe it's not wanted, but they do carry the baby to term and they deliver the baby into the world. It's important to understand that a lot of them do adjust to motherhood, and a lot of them do actually look at motherhood as a positive benefit instead of a burden like they thought it would be. And it's understandable to be scared if you're going to have a child because you've never done it before. And when you've never done something before, you're going to be scared. That's natural, right? You are never going to go into something you've never done before 100% confident. But it's important to understand that most of those women have adjusted. Most of those women adjust to motherhood. All right, 4 times greater odds of ending up below the federal poverty level. So keep in mind, kids are expensive. They're not just something to have, just to play with, right? They're expensive. There are economic resources that suggest that if you're going to have a child, you need to make at least $40,000 a year for that child, to properly care for that child. So that's why it's important, if you're going to be in an intimate relationship with someone, to really understand where your emotional state is, where your physical state is, and where your financial state is, because it's going to affect all of those things. All right. Again, we talked about Roe versus Wade, the legalization of abortion. This is really the main standard case that was utilized. It was a woman who was raped in Georgia, or gang raped in Georgia. Because of this, there were new standards that were devised. All right, so it divided pregnancy into 3 trimesters. So back before then, pregnancy was just known as pregnancy. We really didn't have trimesters. The first trimester, abortion up to the judgment of the woman and her doctor. The second trimester, similar rights up to the point when the fetus becomes viable, which is about 24 weeks of gestation. So remember, the baby can survive out of the womb at about 6 months with medical intervention. But keep in mind that the case that this was built on was actually false. And the woman, Norma McCorvey, who came out about that, is now an advocate for anti-abortion. All right, so again, it's important to have facts. So keep in mind that 24 weeks of gestation, some states are suggesting or are allowing abortions up to 24 weeks. And this is what a 24-week-year-old baby looks like. And so again, it may be tough, it may be maybe emotionally tough for some people to handle, but again, we need to stick to facts. And when you have a 24-week-year-old child, they are getting fully developed, right? Again, they can survive outside of the womb with medical intervention and still be okay, even if they're born at this stage. All right, legal restrictions on abortion. There's multiple legal restrictions. 4 of them specifically physician and hospital requirements. So because of this Roe versus Wade case, physicians were now the requirement to perform those abortions. There's state mandated counseling. Again, it's very traumatic emotionally and physically on the woman. There are waiting periods. So if you decide that you want to have an abortion, there's a waiting period for that. And parental involvement, right? So if you have a 1% case where the child had incest or was raped, or there was incest or something like that was going on, then you want to make sure that there is parental involvement to decide this, because again, it's a very traumatic choice to make. It is not a secret that there is a public debate about abortion. I'm sure we've all discussed our opinions about this to an individual at some point. So the pro-life position is life begins at conception, that a fertilized egg must be afforded the same rights as a human being. So keep in mind that the definition of life is beginning at conception. So if you actually look up that definition, that's what it is. Any woman having sex knows pregnancy is possible. She has a moral obligation to continue the pregnancy to delivery. And again, we understand that there is that less than 1% of those cases where there is a rape, there is an incest, there is a child that had a traumatic event happen to them. We understand those, and this isn't a 100% cover for those individuals that are in this pro-life position, but these are some of the main points that they stand on. Women unable or unwilling to raise a child should consider putting the child up for adoption. So individuals that are in this pro-life position believe that there are other options besides abortion. But the biggest one is just stating on that scientific definition of what life is, and that is at conception. All right. On the other hand, we have the pro-choice position. The decision to end or continue a pregnancy is a personal matter to a woman and should not be compared to carry a pregnancy to term. So here are some of the points that this pro-choice position stands on. Distinction must be made between the stages of fetal development. Fetus is part of the pregnant woman, and the woman has priority. Pregnancy can result from contraceptive failure or other factors out of the couple's control, and most moral decisions possible must be determined according to each situation. All right, so individuals that are in the pro-choice position, they really focus on the idea that the woman has a choice about what's going on with her body versus the baby having those human rights, as with the pro-life position. All right. Nearly half of Americans feel abortion is morally wrong, but overwhelmingly majority support the availability of abortion in some circumstances. And so again, we talked about the circumstances. If someone is raped, if there's a child that has experienced a rape situation due to incest or has become pregnant due to that there are those situations that individuals will actually support the use of abortion. And especially with those ectopic pregnancies, because in that situation, it's either you take the embryo, which again is at a very, very early stage. The woman can feel severe pain within the first month of an ectopic pregnancy. So it's either the embryo gets removed, the baby gets removed, or the baby and the mom both die. Many believe more effort should be made in other areas, so sex education, effective contraception, which we just went over, so hopefully you guys got a lot of good information about that. Policies that make it easier to raise a child, such as parental leave, child care programs, reduced cost for education and healthcare. So there are different programs out there to help individuals who are becoming parents, whether they chose to or not. So there are different options out there, and most Americans feel that those options are more viable versus abortion. All right, so here is just a percentage response in terms of public opinion about abortion. And again, this is kind of old data. This is from 2018. So again, this may have changed since then. I believe 2018. So I believe this is obviously changed since then. But again, there's a shift in terms of individuals that are supporting just generalized abortion. And that's important to understand. All right, so just a summary, the history of abortion in the United States. We talked about Roe versus Wade. So if you want to look that up, the woman's name is Norma McCorvey. And it's very interesting to hear her story and to hear why she chose to lie on the stand about what had actually happened to her in order for her to get the abortion. All right, we discussed facts about abortion, the decision to have one, different methods of abortion, post-abortion care, which is extremely important as well. We described the legal restrictions placed on abortion in the United States, and we explained the current debate over abortion. So again, if you want to go and rewatch this lecture, feel free to do so. You will be utilizing some of this information in your discussion post. So I hope it was very informative for you, and please, if you have any questions, make sure to contact me.